And I think that with that sort of mindset, we're going to be able to belay some of the highest risks in healthcare. That is a machine making a bad choice about healthcare. We want machines to inform decisions, not make them. But we also, at least with today's capabilities, really want to start carving away at the addressable language-based task activities that burden all of our providers.
Welcome to Technovation. I'm your host, Peter High. My guest today is Matt Kull. Matt is the Chief Information and Digital Officer for Inova Health System, a not-for-profit health organization that earns roughly $5.7 billion in revenue annually. He's been in role for roughly a year and a half, and in that role, his responsibilities include developing Inova's overall technology strategy, as well as responsibility for driving digital health innovation and improved care delivery through IT to patients, team members, and the community. I look forward to learning more about the methods he uses to deliver this. Matt has more than 25 years of experience in technology, 15 of them in various healthcare settings, including hospitals, pharmacies, and regional oncology and disease management facilities. Prior to his current role, Matt was the Global Chief Information Officer at Cleveland Clinic. Matt, welcome to Technovation. It's great to speak with you today.
Peter, thank you. It's really a pleasure to be here.
My pleasure, certainly. Well, I would love to. I've shared the briefest of thumbnail sketches of Inova Health System. I wonder if you could take it from there and provide a bit more context as to the business that you're a part of.
Certainly. Inova is Virginia's #1 healthcare system. We operate in 5 hospitals. We have 2 that are under construction right now to continue to meet the needs of our communities. We run the gamut of specialties. We lead in most in the area, and in fact, throughout the DC region. It has been a growing hospital system, and we've grown organically. Our communities, as you know from the area, we tend to keep getting a little more dense here in the DC Metroplex. As a whole, it's a research-focused organization, physician-led organization, and we are the 3rd busiest emergency department in the country. So not only do we have an acute care facility, but we're also here to meet the needs of our underserved in our communities and their emergency needs as well.
Fascinating and great context. I appreciate that. And talk a bit about your role as Chief Information and Digital Officer. What's within your purview, please?
So I have responsibility for all of the typical CIO type of activities, whether that's our data centers or our cloud, but I also have responsibility for our digital aspects, our front door, how we think about artificial intelligence, analytics, biomedical equipment, as well as our strategy around how we improve process across the enterprise to become more lean, to use technology as a benefit. When we talk about digital transformation, which sort of gets used in a lot of different ways, what it really means is it's not a technical paradigm. It's how do we make our business ready for technology? How do we use data in all of our decisions? One of my prime goals here is to really create the most data fluent organization. And this is a collaboration between not only our clinicians, between our business owners, but also our human resources professionals and how we think about talent strategy around hiring people and training people to equip them to think about things in terms of data. Gone are the days, hopefully, of putting your thumb in the wind and trying to feel the direction where it's going and maybe where it will go in the future. Let's use data to be smarter about our decisions and make decisions based on evidence across our entire business, not just in our clinical spaces.
Hear, hear. Very well said. And you mentioned at the outset that the organization is both research and physician-led. I'd love to understand more about how you collaborate with physicians and help drive forward the research agenda in light of what you just described.
Certainly. I look at our women's health as a really good example of how we think about research and using data. We have one of the largest women's health ongoing research facilities that deal specifically with OB-GYN types of cancer. It's a collaboration between a number of hospitals as well as the military. And we use data across these organizations to really try to pinpoint not only pre-markers and precursors for cancer, but different treatments and how they're going to work and what the survivability and outcomes look like over time. We hope that we can get to a place where I can look at you and the things that make up the patient, and I can say that this is the right treatment for your specific biology, and here's where we can be far more predictable about outcomes and what different treatments you might be most receptive to. Those kind of advances, I think, are going to take a lot of the sort of, let's get more accurate the first time, the first regimen, the first treatment attempt, based upon exactly what's happening with you. I think when we do this type of research, what we're really trying to do is create an N of 1 as opposed to a whole disease class. You're not someone who has this kind of cancer, you're just you. And so as we think through those mechanisms, the data sets that we're using continue to grow. And with the advent of AI, the ability to start predicting what makes each person unique and individual more in the organic world, as opposed to just a set of statistics on the back end, is really making for some compelling research across all disease states. But what we're doing in cancer, I think, is by far the most advanced.
Very well said. And I'd love to get further into some of the advances related to AI. Before we do, though, I also wanted to underscore the importance of data privacy to you and to your organization. Actually, you've received accolades for the methods used. I wonder if you could take a moment and describe your orientation related to the topics, especially in light of what you just described in terms of the power that data can have to really personalize care in the ways that you mentioned.
Certainly. All of us have circumstances that are our health that are probably the most private and personal things to us. Whether you've had chronic conditions that you've not been public about, or, even your most recent time that you went to the doctor because you were feeling sick or you were scared or you had a question. This is very human information. It's very private. It's probably something that people hold most sacred. And in that light, the Joint Commission, who accredits most of the hospitals in the country, spent a lot of time thinking about how do we create a set of standards that protect this data. We've seen headlines that have gone almost endless around this data was lost, or this attack happened, or this data leak occurred at a certain site or payer. And I think their philosophy really boiled down to we understand that there's this aim of healthcare to provide better care to more people and to do it cheaper. But maybe there's a fourth component to that, and that is to really protect privacy. And so they came up with a set of standards that were not only procedural around how we allow access to data, how we think about using data, but also how we protect what the chain of custody is around data, how we think about using it in ethical ways. Are patients informed that their data could be used as part of research? Do they consent? Do they have option to consent? And the controls that we have internally to make sure that we're doing bona fide quality or clinical benefit type of research, as opposed to other uses of patient data, which might not be so appropriate. In building that, when I learned of this accreditation, we raised our hands first. We wanted to be at the forefront of this for a lot of reasons, but I think most importantly, Inova is an organization that puts the patient's life and their well-being first. And so to do that, we wanted to demonstrate, again, that we were responsible, not just because we say we were, but because the accrediting body for the quality of healthcare systems across this country say we are. Since us, I know there's a number, dozens of additional health systems that are in the pipeline that are wrapping this up. But it was not just a moniker of saying, hey, we're accredited for this. It was a process. I mean, the scrutiny and the rigor that was put around how we think about data and how we protect it was pretty remarkable. And it showed us a lot of things that I think we hadn't really had in the forefront of how we were thinking about extra miles we could go to protect this data.
Are there any aspects you would call out in terms of some of the unexpected areas? I would be interested to understand that a little bit further.
Well, I think being able to have certain gates in place. So when you go to do research, you go to an IRB, an independent review board, with your study, what data sets you're going to use and how you're going to use them. Well, we have gates now to make certain that that always happens before any access is even granted. We have on the back end of research projects, when your project is done, you want to make sure that that data is sunset in an appropriate way. You don't just want a whole patient record set sitting out on a file server somewhere or in some cloud server somewhere. You want to make sure that there's actually a sunset to the research effort. It allows you to make sure that you've got this end-to-end full life cycle of management around data. And some of those things on the back end, you always, in healthcare, we always know we have to do that. But these are hard and fast and written controlled procedures that have checks and balances the whole way. So the same person who audits the data isn't the same person who deletes the data. They're not the same person. The same person who's doing the study doesn't grant their own access. So we have this sort of set of separations of duty that give us controls along the continuum of data utilization. And when the study is done and when the sharing's done, or when the use of that comes to an end, we close it. And we close it in a way that's meaningful, that we can certify and say, we've taken the right precaution that this data doesn't become orphaned somewhere that could be accessed by others for non-bona fide purposes of that repository of data.
Fascinating again. Again, thank you for sharing a bit more about the philosophy and the methods that you're using accordingly. Well, let's dive a little bit further into AI, a topic that's already come up a bit, and needless to say, a data-centric topic to say the least.
Very much so.
Talk about your own your organization's use of artificial intelligence and how it helps advance some of the causes you've already described.
There's a lot being said about AI in healthcare today. And what I find fascinating about it is it's very new, but we're finding new ways to use it all the time. There was a study that was recently done that says about 60% of all effort in healthcare is some language task. So it's a verbal or typed or written type of activity that's not clinical decision making. So we believe that that's probably the first place we want to tackle. And as you look through this, there's probably about 60% of that that's actually addressable by today's large language models. That means our opportunity spectrum for AI in healthcare today, staying out of clinical decisioning, just in the administrative functions, is roughly about 40% of all working hours in healthcare is an opportunity for large language models and generative AI. This is where we're starting, because we have a couple of compounding problems that are coming our way in society. The first is we have an aging population, and as more people are retiring, we will have more need to take care of people in their prime healthcare years. The population between 60 and 90 years old today is about 55 million people in the US. In 10 years, it's going to be 74 million people. So you have this astronomical explosion of people who between 60 and 90, which is where they're most dependent on acute care settings and hospital systems, that bolus is growing. We also see that we're shrinking. Over that same 10 years, 25% of primary care doctors that are in practice today will likely retire. So you have the entry point to healthcare, which is the most critical. Primary care is shrinking as more and more people need care. And we have a decreasing amount of people that are finishing medical school. It's not a practice that people are streaming towards. I don't think it has the same demand that it once did. So we've got compounding headwinds that we're heading into around how we're going to care for people. And the way that we make up that difference is by enabling sort of human machines to do some of this work. And so if we can start scraping away at the non-physician stuff, at the non-nursing stuff, the things that don't require clinical discipline and expertise, I think we've got a real good shot at making up some of this gap. When I look at the data around what roles we're going to need the most of, how we interact with insurance companies, how we interact with regulatory agencies, how we interact with our own sort of administrative overhead, the more of that gets automated, the more time our caregivers can focus on our patients and do the things that are most important. That is not just making a decision about your care, but connecting with you about your care. Because that human factor that happens between provider and patient, I think, is just as important to the delivery of care as making the right clinical decisions. So that is opportunity number one. And then supporting the right decision support from a clinical perspective, number two. And I think that with that sort of mindset, we're going to be able to belay some of the highest risks in healthcare. That is a machine making a bad choice about healthcare. We want machines to inform decisions, not make them. But we also, at least with today's capabilities, really want to start carving away at the addressable language-based and language-based task activities that burden all of our providers.
And talk a bit about, especially given the fast pace of change you described relative to artificial intelligence, the way you and your team remain informed on solutions that may be relevant or may not, and drawing the appropriate conclusions on either side of that. How do you and your team ensure that you remain abreast of progress that's made in ways that might impact your business?
So myself and many of my colleagues within the digital environment, we all participate in many of the industry functions. Most recently coming up is Vive, that's happening in Nashville in a few weeks, which is a huge organization bringing together healthcare leaders and technologists from around the globe, really. There are constant inputs for everything from what comes on social media where things tend to break first, to deep industry analysis, to our partners at large consulting and their perspectives that they put on healthcare. It's funny, I feel like my evenings are full of almost just trying to stay abreast of what was invented today, as you catch up on your reading during the day. And so I think that it's interesting because media has changed in such a way. Podcast sources, online sources, social sources have become almost near a real-time stream of inventions that happened that in the minute, that afternoon, inventions that happened yesterday. It's not a long-term perspective of talking about what happened over the last few years. I mean, you're consuming things in such small bites because the technology is changing so quickly.
Very interesting. I mentioned at the outset, you've been involved in various parts of healthcare for a decade and a half or more. And I'd love to understand how the role of technology has changed across your tenure. You're already describing, of course, significant investments that you and your team are helping to drive and translating through to the very ways in which a business like yours operates. Talk a bit about your own reflections now with such a substantial tenure in the industry.
I think what's changed is really two things. Technology was for a long time more of like an operational system to sort of underpin and keep things moving through a business. It's now a tool. It's a useful tool in actually conducting that business. When you think about predictive analytics and what supplies we need in what supply rooms, like it's not just about inventory counts anymore. Now we're looking at what the addressable schedule is out for many months, what's currently planned in ORs, and we're staffing not only the ORs and the support staff, but we're also supplying those areas based upon what they're going to need, not based upon some par level. It's remarkable how we're thinking forward. And I think the other really important aspect is that data and how we thought about data and how we use data was very retrospective. We were using information to see what happened last week. We now use information to see what's going to happen next week, or at least predict as best we can. And over the last several years, as we started thinking about prediction, and we started thinking about what's next week, next month, next year going to bring us, we're getting a lot more accurate. What used to be simple regressions to sort of anticipate what might come in the future, we're actually getting really good at this. We can tell how to block OR times. We can tell how to supply our supply cabinets. We can tell what nurses are going to need to be on what floor based on acuity of patient. And we can do it in near real time. So if I have a unit that's full of very highly at-risk patients, I know I've got to staff more people there. And we're doing it the day before, as opposed to calling people in just in time. So it's really remarkable when you think of the difference that is happening around us. And in a lot of ways, it feels on the hospital floors, it feels like it's always been that way. But if you think back, there were a lot of people making phone calls. We need you to come in today, as opposed to let me put you on schedule for tomorrow because we know what's coming. The biggest shift is that we're starting to scratch the surface of the crystal ball. We're looking a little bit into the future, which I think is a remarkable and exciting place to be as a technologist.
Well, speaking of that crystal ball and looking out into the future, I'd be interested in the trends that particularly excite you, Matt, as you look out a year or two or three. What are some of the things that are making their way onto your roadmap that have you particularly excited?
One of the things that I said sort of at the onset of this is that I'm really trying to create a data fluent team member base. And in doing that, as we see things like prompting and large language models, and even when ChatGPT broke, and it was fascinating to watch this because knowing nothing about it, you could go and ask it questions and very quickly ascertain bits of information that were important to you. I don't know how to write this style of letter. How would I write this? And it's doing it. Well, if I can create that sort of fluency across this enterprise where they can look at all of our data and ask the questions that are important to them in the moment, and I can really push decision support out to the edge, I think that would really cap the next 24 to 36 months off in a really nice way. I'm excited about that because we can sit here and look at data all day and try to make decisions for the people that are doing the work. But if the people doing the work can get the information and use it in a consumable way, in a consumer friendly way that doesn't require sitting down and writing some kind of Python, but actually you're asking it natural language questions to get to the information you want, every single aspect of our business will be better. There'll be no more guessing. I'm super excited about that. The other thing that I think is really going to change things is the size and density of compute. When you saw at the CES, the CEO of NVIDIA came out and said, we're building an AI supercomputer that fits in your hand. And he started talking about the power of this thing. And the numbers were obscure that he was using, but when you started to think about it, it's literally an entire data center we would have had 5 years ago in one box the size of a toaster oven. With that kind of density, how we think about cloud, how we think about on-premise data centers, how we think about edge computing is really going to change. And it'll change in a way that it'll put us in a place where we're making decisions we hadn't contemplated, because it's always been a power problem. It's always been a size problem. It's always been a cooling problem. But when you get that small, is it anymore? And the other thing that is coming that I'm really excited about, and I don't know if it's going to be 5G or 6G or 27G, but it's coming. I think we're going to get to a place where we're building buildings and building hospitals for less money because we're not cabling them anymore. We're not putting structured cable for RF, for network, for cable, because what we'll do is we'll have the cellular company put a tower directly outside the building that serves the building. And that's going to change a lot of thinking about how we think about cybersecurity. It's going to change a lot of thinking about how we build. It'll change a lot of things about how the kind of equipment that we buy. A lot of devices are stuck where they are because they're tethered to a network port. Well, if I have super ultra wide bandwidth wireless that is a managed service, do I have to continue to construct hospitals the same way? Can I move patients while they're always connected? And what does that do for being connected to the hospital when you're at home? Because if the technology and capabilities here, it'll be there too. So wireless is something that I'm very excited to see where it goes over the next 5-year horizon.
Fantastic insights, Matt. Thank you for sharing those as well. Important areas for us to keep an eye open for to gauge the continued progress in these areas in ways that may be profound in a business like yours. I wanted to also ask you, Matt, whether or not there's anything you've recently read, watched, and or listened to that you would recommend to others.
My podcast list is really long, but I like listening to some of the people who are a little further out there. You listen to the investors like Peter Thiel and Mark Anderson and others. I hate to admit it, but I'm sort of a Lex Friedman fan. The conversations that he has, people who are really thinking deeply about a pretty narrow topic, I think it gives me a lot to think about how we can address our problems here from a perspective of someone who's not here. And so those long form interviews, I think, are really, really interesting and compelling to think about how people who are potentially operating in different spaces, their normal could become your innovation. The other thing that I think is really important is there's a lot of community groups. I mean, here we're fortunate in the DMC is to have the Northern Virginia Technology Council. It brings a lot of people together. I find that most of the most inspiring lessons that I learn from others tend to be others from other industries. And so I strongly advocate getting involved in those.
Great suggestions all, Matt. Thank you so much for sharing those. And thank you for sharing more about your perspectives, the great work that you and your colleagues at Inova are doing, the remarkable role that data, artificial intelligence, and technology, more generally speaking, are playing to improve outcomes for patients, to make the work of your colleagues easier and more stimulating and more productive. It's been a tremendous conversation. I really appreciate it.
Thank you. I really enjoyed it too.